Which of the following medications is a diuretic? Is it losartan, metolazone, or is it simvastatin? The correct answer is metolazone. Diuretics, also known as water pills, are substances that promotes diuresis. It helps us moving the extra fluid and salt out of the body. It acts by decreasing sodium reabsorption in the kidneys, thereby promoting urination. There are three main types of diuretics. Thiazides decrease the urinary excretion of calcium, while loop diuretics have the opposite effect. Potassium-sparing diuretics are generally weak diuretics that increase diuresis without the loss of potassium. Which antihypertensive medication is an ACE inhibitor? Is it amlodipine, lisinopril, or is it losartan? The correct answer is lisinopril. ACE inhibitors inhibit the activity of the enzyme ACE that decreases the production of angiotensin II, preventing the constriction and narrowing of arteries. Their usage can be also indicated in congestive heart failure, post-MI, and diabetic nephropathy. Which of the following drugs is a calcium channel blocker? Is it enalapril, verapamil, or is it torsemide? The correct answer is verapamil. Verapamil is a calcium channel blocker used in the treatment of high blood pressure, arrhythmia, and angina. Inhibition of calcium influx prevents the contraction of vascular smooth muscle, causing dilation of blood vessels throughout the peripheral circulation. There are two distinct chemical classes of CCBs: the dihydropyridines, such as nifedipine and amlodipine, and the non-dihydropyridines, like diltiazem and verapamil. Which medication is used to treat acute asthma exacerbations? Is it salmeterol, theophylline, or is it albuterol? The correct answer is albuterol. Albuterol, also known as salbutamol, is a beta agonist work as a short-acting bronchodilator. It's used to provide relief from an asthma attack only. Long-term use is not advised. Theophylline and salmeterol are both long-acting bronchodilators, used to prevent asthma attacks and to treat chronic obstructive pulmonary disease, COPD. Which of the following medications is a beta blocker? Is it enalapril, furosemide, or is it metoprolol? The correct answer is metoprolol. Beta blockers, antagonists, are blocking agents that bind to beta adrenoreceptors and prevent the binding of norepinephrine and epinephrine at these receptors, preventing sympathetic stimulation of the heart.
Follow for more quizzes.
What is the first-line treatment for an acute gout attack? Is it allopurinol, colchicine, or is it probenecid? The correct answer is colchicine. Colchicine is an alkaloid given orally to improve the symptoms of gout attacks and familial Mediterranean fever. Also, it's used to prevent future major CV events. It possesses anti-inflammatory, anti-fibrotic, and cardiovascular protective effects. Allopurinol and probenecid are used to lower high uric acid levels in the blood and prevent future attacks, but they will not help during acute attacks.
Which medication is used to treat hyperlipidemia by inhibiting HMG-CoA reductase? Is it ezetimibe, gemfibrozil, or is it atorvastatin? The correct answer is atorvastatin. Atorvastatin belongs to the group of medicines called HMG-CoA, reductase inhibitors, or statins. Atorvastatin is medication used to lower low-density lipoprotein and triglycerides levels and to increase the amount of high-density lipoprotein in the blood. This helps preventing heart disease, angina, chest pain, strokes, and heart attacks.
Which medication is used to reverse the effects of opioid overdose? Is it naloxone, atropine, or is it protamine sulfate? The correct answer is naloxone. Naloxone is a pure competitive antagonist of opiate receptors and has no agonistic activity. Opioid overdose death is preventable if naloxone is administered in a timely manner. An opioid overdose can be identified by a combination of 3 signs and symptoms. What is the therapeutic use of levothyroxine? Is it to treat hyperthyroidism, hypothyroidism, or to lower cholesterol levels? The correct answer is hypothyroidism. Levothyroxine is a medicine used to treat an underactive thyroid gland. Oral levothyroxine is a synthetic hormone that exerts the same physiologic effect as endogenous T4, thereby maintaining normal T4 levels when a deficiency is present. Thyroxine is a prohormone, and our body converts T4 to T3, the active form of thyroid hormone. T3 is not used as a replacement medication because it have a shorter half-life. Which of the following methods of medication administration has the fastest absorption rate? Is it orally, intramuscularly, or is it subcutaneously? The correct answer is intramuscular injections. Intramuscular injections allow rapid absorption, about 20 minutes, and they are less painful than subcutaneous ones. That's all thanks to the rich supply of blood in the muscle fibers and fewer nerve endings. Which of the following drugs is a proton pump inhibitor? Is it ranitidine, omeprazole, or is it famotidine? The correct answer is omeprazole. Proton pump inhibitors act by irreversibly blocking the hydrogen-potassium adenosine triphosphatase enzyme system, or, more commonly, the gastric proton pump of the gastric parietal cells. Their use is indicated in cases of acid reflux, like GERD, duodenal, or stomach ulcers, Zollinger-Ellison syndrome, and can be given in combination with antibiotics in case Helicobacter pylori infection. Which medication is used as an antidote for benzodiazepine overdose? Is it naloxone, protamine sulfate, or is it flumazenil? The correct answer is flumazenil. Flumazenil is a selective competitive antagonist of the gamma-aminobutyric acid, or GABA, receptors, and is the only available specific antidote for benzodiazepine toxicity. Benzodiazepines act by potentiating the activity of GABA receptors, which is the major inhibitory neurotransmitter in the central nervous system, CNS. Which medication is a selective serotonin reuptake inhibitor? Is it amitriptyline, fluoxetine, or is it duloxetine? The correct answer is fluoxetine. SSRIs are a type of antidepressant that have been shown to increase levels of serotonin within the brain by preventing the reuptake of serotonin by nerves. Serotonin is a neurotransmitter that is often referred to as the feel-good hormone. It contributes to well-being, good mood, appetite, as well as helping to regulate the body's sleep-wake cycle and internal clock. SSRIs are one of the most commonly prescribed antidepressants because they are effective at improving mood with fewer or less severe side effects compared to some other antidepressants. Thank you for watching. Like and follow for more quizzes. Which medication is used to reverse the effects of heparin? Is it vitamin K, protamine sulfate, or is it atropine? The correct answer is protamine sulfate. Heparin is a blood anticoagulant that increases the activity of antithrombin. It is used to prevent blood clotting during open heart surgery, bypass surgery, kidney dialysis, and blood transfusions. Protamine is a specific antagonist that neutralizes heparin-induced anticoagulation. It is most commonly used after CABG surgery to control post-operative bleeding, and it's also utilized to reverse the anticoagulation effects of unfractionated heparin in the setting of dialysis, invasive vascular procedures, and acute ischemic strokes. Thank you for watching. Like and follow for more quizzes. Which medication is an angiotensin II receptor blocker? Is it lisinopril, losartan, or is it amlodipine? The correct answer is losartan. Angiotensin II receptor blockers are a type of antihypertensive medication. Angiotensin II receptor blockers stop the action of angiotensin II, preventing vasoconstriction. ACE inhibitors and angiotensin acetylcholine receptor blockers are both first-choice medications for high blood pressure. They work on the same system in the body and work equally well in most people. Also, ACE inhibitors may cause more side effects than ARBs. Thank you for watching. Like and follow for more quizzes.